The Lebauer-Brody Center first started as the Lebauer Cardiovascular Research Foundation in 1991. At that time, we were a not-for-profit foundation that was designed to work in conjunction with the cardiovascular care at Cone Health. Our mission has always been to improve the lives for the patients for whom we care. That has never changed, and it will always be the mission of this organization.
So one of my passions is cardiometabolic disease. So it's things like high blood pressure, high cholesterol, obesity, and we've seen that all of these are sort of running rampant right now in the United States and across the world. So one of the issues is fractured care. Right now, cardiologists might take care of the high blood pressure and the high cholesterol, and maybe you have an endocrinologist if you have diabetes. It's all a little bit here and a little bit there, and there's not really one group that sort of owns it. And so one of the clinical trials that we're doing right now is to try to get cardiologists a little bit more involved in some of the treatments for this group of cardiometabolic patients, understanding that this isn't just about one aspect of the puzzle. It's that if you have to treat the patient and all of the things that go together and not just the individual pieces.
So Cone has a very long history of cardiovascular innovation, and actually it's a big part of what made me want to come and work here. What I'm hoping for is that we can move away from treating heart disease and towards preventing it. So having a research center integrated into our care and our systems helps us to make sure that we are quantifying what we're doing, helps us to make sure that the things that we think will be beneficial truly are beneficial, and it allows us to share those results not only within our system, but also with the world.
I think clinical trials here at Cone have really formed the backbone of all we do at Cone, and I think they set the tone, but also to have this background of never being satisfied with the status quo. When the beginnings of angioplasty for acute heart attack, people around the country were giving clot-busting medicines to patients in that setting, and a lot of people were satisfied that that was the status quo. And people who began this program said, we think we can do it better. So much so that it got national attention in the New York Times and other publications. And I think for me, that has set the tone for how I want to practice in my career. We have good therapies that support patients, but we're always looking, how do we do it better? How do we look for these newer therapies that are really going to be game changers? And can we get the data to prove it? Because certainly, I'm in this community for my life and my family's here. And, I want people to benefit from the best quality cardiovascular care they can get, the same care that I would want for my family.